Stephanie Bell Flint joins us now to talk about the inability to become pregnant. If you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us today is Dr. John Wooley with Baptist for Women and the Women's Clinic. And Dr. Wooley's been practicing for a very long time. And of course, you do a little bit of everything, but you also cover some fertility issues.
I do.
How do you know if there's a fertility problem?
Well, you start by the history, and about 85 to 90% of people will get pregnant within the first year, but there's a small percentage of patients that won't. So you just basically, how long has somebody been trying, whether or not they have regular predictable periods, whether or not they have anything in their history that might indicate a problem, severe pelvic pain, severe menstrual cramps, whether or not their spouse has had any particular problem, or whether or not he has had any problems having children in the past, whether or not there's any history of any type of sexually transmitted disease or anything that might lead to a tubal insult. All of those are factors you need to consider.
What are the most common infertility problems?
Well, when you're talking about how it breaks up, about 25% or about a fourth of the time it's actually a male infertility issue. And then there are some, about 25%, where there's an ovulatory problem with the woman. You might have that suggested if somebody has irregular cycles or does not have regular periods. If a woman has a regular period every month, the likelihood of her being ovulatory is very high. So about 25% of the time it's an ovulatory defect. Other factors might be 20% where there's a problem with the tubes, because in its simplest form, a woman has to ovulate, a man has to have an adequate sperm count, and the two have to be able to get together.
Well, I was about to ask, what can you do as a couple when it comes to dealing with this?
Besides the obvious, is that what you mean?
Well, I wasn't going to say that, Stephanie.
Yeah, besides the obvious.
Well, the basic infertility evaluation is basically, can you document that the woman's ovulating? And we do that by blood test. And there are some other ways to do that, but if a woman has a regular cycle, then a blood test can confirm that. There are x-ray tests that look to determine tubal patency to make sure there's no problem with the tubes. And then a sperm analysis is the way we evaluate the male factor.
Is this a pretty prominent problem?
It is, but even though it seems like it's more prevalent than in the past, it's not really more prevalent. It's just that, number one, the baby boom generation, there are more people attempting pregnancy. And age is also a factor. And so if you're in your late 30s or early 40s, it may be more difficult to conceive. And also with the assisted technologies that we have now, there's a lot of press about in vitro fertilization and other amazing technologies that are available, whether it be frozen eggs or frozen embryos, and also just the press exposure that wasn't present in the past. So actually the prevalence is not really different.
What about a woman who has a tubal ligation and then decides she'd like to get it reversed in order to get pregnant? How likely is that?
Well, in the past, when you had somebody in that situation, we would surgically re-anastomose the tubes. But now with a success rate of in vitro fertilization, actually most people would bypass the re-anastomosis of the tubes and suggest in vitro, because actually the success rate is actually higher.
Oh, cool option.
So we can all go and start having kids again.
Yeah, can't
Not
wait.
me.
I love having babies.
I know. Thank you. So, do you have lots of women like her? Just curious.
Absolutely. We love those kind of women.
I bet he does.
Keep them coming. Thank you so much, Dr.
You're
John
welcome.
Wooley with the Women's Health Clinic over at Baptist. And for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.
Thank you so much, Dr. Wooley and Stephanie.